Today I want to talk to you about Phase 1, both statewide and also in Northern Virginia, and when the DMVs may open. We'll be joined later today by some local officials from Northern Virginia to talk about how we are working together regarding Phase 1 in that region. First, in March, I closed all of our DMVs to customer service locations as we work through the spread of this virus. Starting Monday, we will begin to allow a few DMV customer service centers to open back up to the public for a select number of services. We'll start with 11 DMV centers in 7 of 8 regions. Northern Virginia centers will not open at this time. These open centers will focus only on services that require someone to come to DMV in person. Things like getting an original driver's license or original vehicle registration or title, disabled parking permits, and vital records. These services will be provided by appointment only, and customers will wait in their vehicles. Anyone who can use DMV's online services should continue to do so. As we continue to ramp up testing, we did 8,845 tests yesterday, which is closer to our goal. We're doing more testing at long-term care facilities and around the state. Pharmacies and drugstores are stepping up to help with testing. Rite Aid has been doing testing in 2 sites, performing more than 1,200 swab PCR tests through this past Monday. I'm grateful to these retailers that are working with us to increase our testing, and we'll continue to see more of this. For example, in the coming days, I think we'll hear some exciting news about Walmart and their testing efforts. As we have said, robust testing is a critical piece of our plan to slowly ease restrictions in Phase 1. We are getting there, and that is one reason why I feel comfortable in allowing Phase 1 to begin this Friday for most of our Commonwealth. As we have discussed in these briefings, moving to Phase 1 depends on meeting a set of health metrics, an increasing number of tests, a downward trend in the percent of tests that come back positive, a downward trend in the number of COVID patients in our hospitals, the availability of hospital beds, and the availability of PPE. As a Commonwealth, these metrics are trending in the right direction. Phase 1 will not be like turning on a light switch. We will restrict non-essential retail and houses of worship to 50% of the building's capacity. Gyms and fitness centers must remain closed, but we'll allow them to do outdoor fitness options until we get into Phase 2. Restaurants must remain closed, but we will allow those with outdoor seating to use that at 50% capacity. We'll allow salons and barber shops to operate with strict requirements for social distancing and face coverings. And we will follow the same metrics which allowed us to get into Phase 1 when we determined entering Phases 2 and 3. We know that working parents need a safe and healthy place so they can return to work. During Phase 1, our child care centers will continue to prioritize the children of all working families while abiding by social distancing and cleaning requirements. The health and safety of children, families, and staff is a top priority. Employees who need to find child care so they can return to work can call 866-KIDS-TLC. So I'll repeat that, 866-KIDS-TLC. But I want to emphasize, as we enter Phase 1, we will still maintain the ban on gatherings of more than 10 people. We still urge businesses to keep their employees teleworking, and we strongly encourage the use of face coverings in public. will require face masks for some businesses, such as restaurants and salons, and require essential retail businesses to provide masks for their employees. More detailed guidance for Phase 1 is available on our website. Phase 1 represents a small step forward, but we will remain vigilant. We will continue to monitor health data closely. I again want to remind all Virginians, this virus has not gone away, and everyone needs to act accordingly. Continue to stay 6 feet from others. Wear face coverings, not just to protect yourself, but to protect other people. You will be safer at home unless you need to go out. Moving forward requires us all to act responsibly. We cannot act as if things are back to normal because they are clearly not. Phase 1 is a floor, not a ceiling, and I'm open to some regions moving more slowly. I have said that if specific regions are not meeting the health